Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is September 4th, 2020. As always, we start with our COVID-19 statistics. Worldwide, we have over 26.5 million cases, as well as over 875,000 deaths. In the United States, we have nearly 6.4 million cases and over 191,000 deaths. The biggest public health news this week shouldn't have even been news, but it was blown way out of proportion and misrepresented by so many people that it became a huge deal in the news and social media. What I'm talking about is the CDC added a bit more information to the regular reports than what they've given in the past. They broke down the deaths caused by COVID-19 to show more detail about contributing causes of death. To understand what this all means, we need to take a little quick step back and just talk about what is on death certificates. The main thing we need to focus on for this issue is just the cause of death that's on the death certificates. Most states, some states might just have one or two causes of death listed there. Most states have three or more spots for it. And those causes of death, usually there's a primary cause of death, and then there's also contributing causes, though some states, very few states, just have overall causes of death, not, no primary or secondary, anything like that. Just list them as you want. As we all know, COVID-19 is not just a respiratory disease. In these weekly reports, in past weekly reports, we've talked about heart issues, lung issues, kidney issues, many other problems that COVID-19 can cause. And what's been happening for most death certificates for COVID-19 deaths is that COVID-19 is listed as one of the causes, and then additional causes are also listed. The problem arose this past week when people who either had an agenda or possibly who honestly didn't know any better posted all over social media that deaths from COVID-19 were really only 6% of the total numbers that we've been told. That 6% is actually the number of deaths that listed only COVID-19 with no other contributing factors. That does not mean that the other 94% were not caused by COVID-19. In fact, the CDC has shown that 95% of COVID-19 deaths listed COVID-19 as the primary factor, with only 5% having it listed as just a contributing factor. So instead of proving that COVID-19 is less deadly or dangerous, like the ones who started this would have us believe, this additional information actually reinforces what the science has told us all along. COVID-19 is dangerous, not just in its deaths, even though that's really important, but it's also dangerous because it causes or exacerbates many other additional issues. The biggest takeaway here, don't believe everything you read on social media. If it says something that's against what the science has told us already, take it with a grain of salt, do your own research. Also, if it starts off saying there's a conspiracy theory or what people don't want you to know about something, yeah, that's clickbait. Chances are not true. Speaking of conspiracy theories and false information, a new analysis has shown that hydroxychloroquine really doesn't work. We've already gone over this multiple times, but there's a new study, a new analysis that tells us this all over again. They looked at many previous studies and were able to determine that hydroxychloroquine by itself has no significant effect, plus or minus, on COVID-19. They also looked at hydroxychloroquine combined with azithromycin, which is an antibiotic, which of course has no effect on viruses since it's supposed to work on bacteria. Don't know why people were saying that would work. But anyways, they tested it and they found that actually more people die using the combination of the two than just leaving it alone and not giving them anything. So definitely do not use hydroxychloroquine. It does not work. Okay, let's get that clear. We've already said it many times in the past, but please, this keeps coming up. Hydroxychloroquine does not work, no matter what you mix it with or anything like that. All right, so we talked a little bit about the Sturgis motorcycle rally in South Dakota last week. This week, the first COVID-19 death from that rally was reported. It was in Minnesota. Also, the number of cases traced back to the motorcycle rally has increased dramatically to almost 300 cases. Throughout the United States, outbreaks are happening in colleges, high schools, elementary schools. The worst outbreaks, almost without fail, are happening in areas where anti-mask sentiments run high. Though there have been tons and tons of studies that support wearing masks, they show that masks work. Some of the best evidence is seen by just paying attention to where people aren't wearing masks, and lo and behold, they're the ones with the outbreaks. So it should be perfectly clear now that masks work, but for some reason, some people want to believe politicians who have a history of lying and are the butt of jokes because of it. They'd rather believe them than scientists who do not have a history of lying. So I don't understand it. Anyways, one bit of anecdotal evidence that really drives home the point that wearing masks is important is a story out of South Korea. A woman with COVID-19 sat in a Starbucks underneath the air conditioner, so it was spreading her viral load everywhere. At least 56 cases of COVID-19 have now been linked to that one customer. The infected person and other customers in the Starbucks were not wearing their masks the entire time because, of course, they were eating or drinking things. At the same time that customer was there were 4 employees working at that Starbucks. Those 4 employees were wearing their masks the entire time. None of those employees got sick. Just another story to show you. Masks work. Please wear them. The Big Ten Conference has stated that at least 15% and possibly up to a third of the athletes that tested positive for COVID-19 have inflammation of the heart. We talked a little bit about the inflammation of the heart last week, stressing that it is dangerous. It can cause death or other heart-related issues. And it can be caused by doing moderate to intense exercise while sick with COVID-19. So if you suspect you're sick, or especially if you've actually gotten a positive result from a COVID-19 test, please do not exercise for at least 2 weeks, at least not any moderate to intense exercise or any other strenuous activities. Don't do it for at least 2 weeks. Let your body recover. It's more important that you don't die or have other heart issues than that you keep your body in perfect shape. Exercise is very important. We normally say, yes, do the exercise. But in this case, we're saying, please take a break. South Africa has found a positive side effect of the COVID-19 pandemic. As part of their response to the pandemic, they instituted restrictions on alcohol sales. After those restrictions went into effect, alcohol-related admissions to hospitals dropped dramatically. That included alcohol-based violence, gender-based violence, car accidents, and others. The alcohol ban expired in June, and those alcohol-related hospital cases started increasing again. The ban was reinstituted in July, and those cases went down again. This is the exact opposite of what's happened in the United States. Many states during the lockdown or stay-at-home period actually said that liquor stores were essential, and so they didn't have to shut down. Also in the United States, domestic abuse has been increasing. Now, a lot of people say that this is just because people are stuck inside, but in South Africa, they actually saw those numbers go down, even though they were also stuck inside, but they just didn't have access to the alcohol. So it's well known in the public health community that alcohol often drives violence and causes many deaths directly or indirectly each year. Even common sense tells us that reducing access to alcohol would increase overall health. There really is nothing good from alcohol that we can't get from other sources, and the negative side effects of alcohol are huge. Speaking of alcohol, a new study has found that transplanting fecal matter from someone without an addiction to alcohol to someone who suffers from alcoholism can help that person overcome their addiction. The fecal matter transplant changes the makeup of the gut microbiome. So this gut microbiome, meaning the bacteria and other organisms that live in our gut, has been in the news quite a bit lately. Another study found that a person's gut microbiome can affect and be affected by sleep patterns and blood pressure. So more research definitely needs to be done, but the gut microbiome seems to be a very important thing for our overall health. Back to COVID-19. Multiple vaccine candidates have had promising early test results. The CDC has indicated that states should get plans in place as quickly as possible for distributing the vaccine once it's available. The FDA may approve distributing the vaccine before the phase 3 studies are finished if early results continue to show that the vaccines are effective and safe. We all hope that an early release of the vaccine is motivated by actual scientifically backed evidence and not political maneuverings. We'll see what happens. Regardless of when vaccines are first available, the World Health Organization estimates that the vaccine will not be widely available until the middle of next year. Before then, the initial doses will likely be for healthcare workers and those who are most in danger of serious complications from the virus, such as the elderly. Some common steroids have been found to reduce the number of deaths in severe cases of COVID-19. Dexamethasone had already been shown to help in previous studies and has been used to treat COVID-19 since June. We talked about that in a previous weekly report. More studies have now shown that hydrocortisone, a very common steroid, and methylprednisolone also save lives. Since steroids can have negative side effects, however, it is currently recommended that they only be used in severe cases of COVID-19. Also, tests done with these steroids show that they really don't have any effect on mild cases of COVID-19. A new antibody therapy has reduced the risk of death and the need to use ventilators in COVID-19 patients by 80%. Hospitalization time was also reduced from an average of 11 days to just 5 days. The therapy is still in the study phase, but those results are very good. We've mentioned in the past how important it is to get your flu vaccine, especially this year with additional pressure on hospitals from the COVID-19 pandemic. A common question about the flu vaccine is, when is the best time to get it? Any time between now and the middle of October would be ideal. The flu season usually starts in late October or early November, so the more people with the vaccine by then, the more likely the flu season won't be as severe. It does take a couple of weeks for your body to build up the immunity after receiving the vaccine, so it's better to get it a little earlier. Don't wait until the flu season is in full swing. The vaccine does last for quite a while, so there's no need to worry that getting the vaccine in late August or September, like if you've already gotten it, would cause your protection to decrease by the end of the flu season in April or May. Getting the flu vaccine in early August or even July would still protect the majority of people through the worst part of the flu season. Protection may wane for the elderly before flu season is completely over, though, if you get it that early. So typically the best time would be late September, early October would be the best time for that. Also remember that while getting the vaccine before the flu season starts is the best option, and getting it during the flu season is better than not getting it at all. Moving on to environmental news, ice sheets in Greenland and Antarctica are already melting at rates that match the worst case scenarios for rising sea levels over the next 80 years. Scientists acknowledge that there may be flaws in their forecasting models which give too much weight to melting ice sheets versus other scenarios that could raise sea levels, but they're still alarmed at how much melting is going on. If sea levels rise even just 2 feet, which is slightly less than the current projection for the end of the century, many cities around the world that are on the coasts would see massive flooding. The introduction of fresh water from the ice sheets into the oceans would also cause issues for fish and other ocean life, as well as throw off the world's climate by making hurricanes and other extreme storms more likely. All of that would definitely cause a public health nightmare. So what can we do about it? Well, part of global warming is the natural cycle of Earth and Sun. We can't change that, but based on the best scientific information we have right now, the natural cycle is only a small part of the global warming. Most of the global warming is caused by humans. Of the things that cause global warming that we can actually affect, transportation and electricity generation are the biggest contributors. So what does that mean for regular people like us? Well, we can ask our representatives to regulate things that cause global warming, but there's a lot of pushback against those regulations, so we also need to do some things ourselves. The change that will make the biggest difference is to use fossil fuels less. That means drive less, walk and bike more. Use public transportation if you can. If you must drive, use the most efficient route possible and share a ride with someone else. Also at home, limit your energy use. Turn off lights when you're not using them. Use a fan if possible instead of air conditioning. Wear a sweater instead of turning the heat up, and improve your house's insulation. Use solar or wind energy if possible, and eat less meat, since it takes a lot more energy and water to grow animals for eating than it does to grow plants for eating. In addition to reducing our energy use, we can also plant trees. Trees naturally soak up carbon dioxide, which can help reduce global warming. Now, all these things are just small things. They won't make a huge difference unless we get a lot of people doing them. So I encourage everyone to recommend to your friends to start doing these things. Not only will it help the climate, in reducing global warming, but all these things will also help reduce your own bills. So if you're not in it for saving the environment, do it for saving your own pocketbook. Finally, in nutrition news, scientists have found a strong correlation between eating highly processed junk food and shorter lifespans. The study showed that telomeres, components in our cell that are linked to aging, are shorter for people who eat a lot of junk food. So if you needed another reason to ditch highly processed food, maybe this is it. Thank you for watching the Plain English Public Health Weekly Report for September 4th, 2020. For even more public health news, please see the many links below the video. I'm Richard Greenland, and you have a healthy weekend.